Hello and welcome to another agency training from Community Alliance for the Homeless. And today we will be discussing trauma-informed care approaches. If you've watched any of our other videos, we have alluded or mentioned, what is trauma-informed care? We can all do it. And this training today is going to be a deep dive on trauma-informed care approaches and how you and your organization can implement best practices on providing trauma-informed care to individuals experiencing homelessness. A lot of people ask us, well, why should our organization be trauma-informed? Or kind of, aren't we already trauma-informed? But the reality is that most people have experienced trauma, and many people have had multiple traumas, and trauma affects us mentally, emotionally, physically, socially, and spiritually. Many untreated traumas can lead to PTSD, depression, and other mental health diagnoses. And when we work in a social services sector, the reality is we are interacting with individuals who have experienced significant trauma in their life. And so we want to define trauma today. And a great way to think about trauma is kind of the 3 E's. So individual trauma results from an event or a series of events or set of circumstances. That is experienced, so experience, the second E, by an individual as physically or emotionally harmful or life-threatening. And that has a lasting adverse effect on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. So event, experience, and effect. All of these things are the result of, these adverse effects are the result of events and experiences that we all have in life. And some of us often have many more negative events or experiences in our life, and those things can compound. Forms of trauma can be violence or witness or exposure to violence, abuse, neglect. Maybe they have experienced some kind of war zone trauma. They may be a refugee or seeking asylum, traumatic grief, terrorism, immigration experiences, much like the refugee experiences, medical trauma, natural disasters, or even military experience. Violence comes in, or trauma comes in many different forms, and we all might not experience those things in the same way as well. Something that may be traumatic for one individual may not be as significant or traumatic for the other, and that all, it's very subjective, and so we really don't know on an individual level what people have experienced, but we know that those things can have negative effects on their well-being. So when we think about the experience of homeless, what makes that experience traumatic, or is it traumatic? Many individuals who were in the session that we did live rattled off 5 things right as we asked this question. But I think it's true and good to reflect and think about, wow, there are many, many things that make the experience of homelessness traumatic. And oftentimes individuals who experience homelessness have had many things come before the actual acute moment of homelessness that have been traumatic. So this is just kind of another blow. And so trauma-informed approaches, especially when we're dealing and engaging with individuals experiencing homelessness, is very important. So a couple of stats on trauma and homelessness, like I was getting into a second ago. Approximately 50% of homeless women report that domestic violence was the immediate cause of their homelessness. And over 90% of homeless women have experienced severe physical or sexual abuse at some point in their lives. 38% of all domestic violence survivors become homeless at some point in their lives. And so when we look at these statistics, we realize that homelessness and trauma are intertwined, especially talking about, women and children. That presence of violence can lead for things to become very unstable in someone's life, and can cause homelessness. when we understand that, when we have that lens of seeing that trauma is compounding an individual's life, it may start to alter our approach with clients as social service workers. And trauma-informed care creates a paradigm shift, but all of our services stay the same, right? So we start to look at our work differently. We look at our approaches differently. We look at the colors on our walls, or the things on our desk, or the way that we greet people when they walk in the office. We start to think about those things in a trauma-informed care approach, but nothing really kind of about our organizational mission, none of that. That all stays the same. So trauma-informed care really is a slight approach that makes a huge difference in the services that we are able to give. So, another great, not necessarily acronym, but just kind of 4 list off of kind of the 4 principles of trauma-informed care and direct client service are that it realizes that trauma can affect family groups, organizations, and communities as well as individuals. It recognizes the symptoms and signs of trauma in clients, families, staff, and others involved within the system. It responds by fully integrating knowledge about trauma into policies and procedures and practices. And it resists re-traumatization of clients as well as staff. And that's huge, right? We need to avoid that really at all costs, at all means possible. How can we make this process of accessing services, of getting help, as least traumatic as possible for individuals? There's no need for them to relive all of their trauma to validate the services that we're going to give them. And so, again, if you've watched our mental health training, this is kind of the 6 key pieces of trauma-informed care that we touched on in the mental health training, and I'll just touch on again here, is we want to emphasize safety, right? You here in my office today, you are safe, and we will take care of you. We will do everything that we can to take care of you. We want to create a trustworthy relationship, and trustworthiness and kind of cultivating trust within your relationship with a client doesn't come from false promises or full promises, but being transparent and honest about, this is the process we've got to go through to get you where you need to be. Peer support is huge. How can we connect you to individuals who may be a few steps ahead of you in our program, or kind of creating that family dynamic, wrapping people in community, collaboration and mutuality. So thinking about how can we plug you into available resources in our community or with other organizations that you may benefit from. Giving the client voice and choice in where they're going to go and how they're going to respond from this moment. So taking an empowerment approach, and then understanding that trauma is a result of cultural, historical, social processes, much like gender dynamics. All of these things that we experience, they are social processes, and we are all vulnerable to them at some extent. But the intersection of historical and gender and cultural and racial issues do impact individuals at greater or lesser degrees. And so, how can we understand that as a direct service client provider and address some of those issues? So again, this is just pulled from the CDC, but a visualization of those 6 approaches, 6 guiding principles to trauma-informed approach. And you see that kind of safety being this first one. How do we create a safe environment so that we can address all of these other things? So just laid out in a little bit of a different way. If you or your organization is interested in learning more about trauma-informed approaches, please feel free to reach out to Bernita Edelman at the Crime Victims and Rape Crisis Center here in Memphis, Tennessee. She's got some great resources available, and I know she would be more than happy to share about what they are doing within their organization to take a trauma-informed approach. You can also contact your COC planning director, Julie, at caf.org with any questions, or leave a comment in the video below. Thanks for watching, and we'll talk to you guys soon.